My name is Vasilia Varvaregu, and I'm a medical resident at St. Elizabeth's Medical Center in Boston and a visiting scientist at the Harvard School of Public Health.
I'm Stefanos Kales. I'm the senior author. I'm an associate professor here at the Harvard School of Public Health, and I'm the chief of occupational medicine at the Cambridge Health Alliance.
The title of the paper is Law Enforcement Duties and Sudden Cardiac Deaths in Police Officers in the United States, Case Distribution Study.
Previous studies from our group had looked at United States firefighters, and we had found in several studies that during strenuous duties, both physically stressful as well as psychologically stressful duties, the risk of acute cardiovascular death was dramatically higher.
Therefore, we decided to investigate if specific law enforcement duties, especially strenuous duties, were associated with a higher risk of sudden cardiac deaths among United States police officers as compared to non-emergency or less stressful duties. We identified sudden cardiac deaths among United States police officers from two national publicly available databases. One is the National Law Enforcement Officer Memorial Fund and the Officer Down Memorial page. We tried to include all sudden cardiac death cases, including those that were initially excluded, and we ultimately identified 441 sudden cardiac deaths that occurred between 1984 and 2010.
In order to compare the relative risk of sudden cardiac death across different types of law enforcement duties, we utilized national survey data that we obtained from frontline officers from two different police unions, as well as a national survey of police chiefs regarding how officers spend their time. The next step was then to take the distribution of sudden cardiac deaths in each specific type of police duty and then match them up with the survey data. Using then the ratio of observed to expected counts, this allowed us to calculate relative risks for each specific type of duty.
The risk of sudden cardiac death was 34 to 69 times higher while the officer was restraining or having an altercation with a suspect, 32 to 51 times higher when the officer was pursuing a suspect, 20 to 23 times higher while the officer was participating in physical training, and 6 to 8 times higher when they were participating in medical or rescue operations.
We were able to demonstrate definitively that during stressful law enforcement duties, the risk of sudden cardiac death is dramatically increased compared to routine and non-emergency duties. The results of our study call for the implementation of both primary and secondary prevention efforts to decrease cardiovascular disease among U.S. law enforcement officers. Our results support the agenda of the United States National Institute for Occupational Safety and Health that prioritizes cardiovascular research among police officers, similar to existing efforts that already are provided for United States firefighters. The next step in our research would be to examine the effects of various types of interventions, both lifestyle as well as medical, on decreasing the risks of cardiovascular disease among U.S. police officers. We would like to thank all of the organizations and individuals who helped in an invaluable way with this research. Without them, it would not have been possible. And finally, we would like to thank the funders who made the investigation possible.